Hello everyone, and thank you for coming along to this latest of our tea break sessions, our May session, in which we will be talking about disabled audiences and attitudes to engagement post-COVID. I'm Oliver Mantell, I'm Director of Evidence at the Audience Agency, and I'm here with my cup of tea. And by way of description, I'm a middle-aged white male with blonde hair, a little bit of a tan because I've been walking recently. So that's me. And we'll be talking in the usual kind of quite informal setup through a little bit of data we've got about disabled audiences from the Cultural Participation Monitor, which is our nationally representative survey of the whole population, looking at attitudes and experiences and behaviours about engagement before, during and after COVID. And particularly this time, we've had support from VocalEyes, and we'll hear from Matthew from VocalEyes in a minute as well, who's just waving there on camera, to boost the sample to make sure that we had lots of responses from disabled people to then be able to look at some of these results, focusing specifically on disabled people and disabled audiences in particular. So that's what we're going to cover. I'm going to chat about a few bits of data to start with. Then I'll hand over to Matthew to sort of comment a little bit on his thoughts about that. And then there'll be a chance for you to share your thoughts or to ask questions, but do also ask questions in the chat on the way through. Now, the final little bit of introduction, which maybe I should have started with, but the final bit of introduction is to say that we have Bruce here who's doing BSL interpreting. So you can watch him, and we'll obviously save the video as well with his contribution. If you would like automatic transcription, it's available at the bottom of the screen. I know someone had asked about using a different transcription service called Otter. Do contact one of my colleagues, Lou, who you should see in the chat, if there's any issues getting that set up. And just generally, if you have any questions or queries on the way through, please do ask, and we'll do what we can to help. Oh, there's a comment in the chat. I should have also probably asked one of my colleagues just to keep an eye on the chat and let me know if there's anything that people want to ask. Oh, brilliant, that's just Lou offering support. So let's grab a swig of tea and off we'll dive into the data. I should say at the outset, we will also share all of this with you afterwards. So there'll be another chance to kind of see some of these figures or to kind of look at them in more detail. So the Cultural Participation Monitor, as I've mentioned, is a survey of the whole population. It's designed to be representative by region, by age, by ethnicity. And we've also got this really good sample of disabled people in this particular wave. So the question we asked, just to be clear, is whether people consider themselves to be deaf, disabled, or with a long-term health condition. For those that said yes, we then also asked them which of the list on the right they would describe that impairment or health condition. So there's a wide range of things there, including things like impaired vision, partial sight, etc., impaired hearing, breathlessness, difficulty with mobility. Oh, sorry, I'm behind Bruce. There we are. Difficulty speaking, dementia, memory loss, anxiety and depression, or other conditions, whether other mental conditions, mental health conditions, or other impairments. So a wide range of responses. Of course, we can't guarantee that it's completely representative of the whole population for each of these particular characteristics. So just to be specific, we had about a fifth of all respondents saying that they were disabled, and anxiety and depression and or other impairment of various sorts being over a third of these, but followed by people saying it's being difficult, finding it difficult, or being unable to walk. However, of course, people did pick multiple categories as they were able to. So on average, people selected 1.7 of these categories. They picked any. But that when we talk about disabled people within this, that's who we're referring to. We haven't on this pulled out the details on particular types of disability impairment, but we will later on when we write up some findings in a report. And we're also looking to share an article co-written with VocalEyes coming out of this as well. But your feedback and wider consultation with the sector will go into that to make sure we've included people with more expertise around disability and indeed more direct experience. So just a little bit of background context before we move into this data. And this is looking at the Taking Part survey, the national survey run by DCMS, which looks at arts engagement in general. And it showed that if you look back as far as 2005-06, there was really quite a big gap in the engagement levels in arts and cultural activity between people who did and didn't have what they described as long-term disability. This is almost a 10% gap. That has progressively got smaller, so that just pre-COVID, that gap had pretty much closed. It was about half a percentage point difference between those two groups. And there'll be a range of reasons for that. Obviously, a lot of that will be work done within the sector to be more inclusive, wider accessibility, and so forth. However, of course, if that's a good news before COVID, COVID itself has brought all sorts of sort of particular challenges for disabled people over and above those for everybody else. And as a result, the bit I'm now going to share is looking at some of the different findings we had and about how they were different for people who are disabled as opposed to not disabled. And really this, I think, spells out in a way that maybe isn't a surprise, but is perhaps useful to see in black and white, the particular impacts and challenges that COVID has created for disabled people. By and large, disabled people are more likely to say that they're less satisfied with their life now compared to before COVID. So it, on a really sort of fundamental measure, it's had more of an impact in terms of general life satisfaction. And for many of these figures, as luck would have it, the figure is about 10 percentage points different. So there's been a greater impact on general life satisfaction, and indeed there's been a greater impact on finances. We've seen all sorts of variations in financial impact across the population, but generally speaking, there's been greater negative impact for disabled people. And of course, greater financial constraint is likely, people are telling us, to mean they're likely to spend less on entertainment and leisure than they previously would have done. So again, it's about a 10% percentage point difference. Now, lots of people have been working from home more or for the first time during COVID. Disabled people are more likely to be expecting to work from home in the future, but indeed were more likely to be working from home to start with. So there isn't a particular difference in the proportion of people who became more likely to work from home, but there was already that kind of difference in amounts of working from home. So we're going to publish a report shortly about the overall impact of working from home and what that might do to attendance. And it's worth noting that findings like that are always going to be particularly relevant to disabled people, albeit affected by other circumstances as well. Disabled people prefer working from home. Of course, and if I remember the figures correctly, it's something like 60% of deaths from COVID-19 in the UK have been of disabled people. So there is clearly a much stronger health impact, and that's reflected by a greater concern about the impact of falling ill with COVID. So again, there's a much bigger split here, 60 to 43% in terms of impact, and greater concern about catching COVID in a range of contexts. So we asked people whether they felt there was a very low, a low, and neither a high or very high impact of catching COVID at indoor events, at outdoor events, and indeed in everyday life. For all of those categories, there was a greater perceived risk of catching COVID among disabled people, particularly at indoor events. So we're talking about 1 in 5 people saying it's a very high risk of catching COVID. And clearly that's a real kind of barrier in terms of people feeling comfortable attending things, and flags the importance of measures, safety measures, which we will come on. The other piece of the puzzle, which obviously fits into that, is the impact of getting to events in the first place, and public transport is something that is a particular concern. Again, it's about all the proportion of people feeling that they strongly agree, they feel nervous about travelling on public transport if they're disabled. We have seen, however, more digital engagement and more, a greater increase in digital engagement during COVID, but not by a huge amount. But yeah, to a certain extent, was I think already higher levels of digital engagement amongst disabled people in any case. So the net result of all of those things, so all these greater challenges, greater impacts, etc., greater risks, is that disabled people are less likely to feel they're back to normal in terms of attendance, again by about 10 percentage points, and be less likely to describe themselves as happy to attend events. So about 29% of people saying happy to attend, compared to 41% of non-disabled people. By way of context, where we've seen the willingness to attend shifting in the course of the pandemic, that 29% are for disabled people now, or more precisely from last month when we did the fieldwork, is about the same that we would have had maybe 6, maybe 9 months earlier in the general population. Exciting echo. Okay, so if that's the overall picture, I'm now just going to say a couple of things about 2 specific areas. So one of these is about COVID safety measures in particular, and then the other is talking about sort of, if you like, access measures more generally, because we asked people about their opinions about access measures, sort of aside from COVID. So again, this won't come as a great surprise, but there is a greater desire for COVID safety measures at cultural venues from amongst disabled people compared to the whole population, to a significant but not overwhelming extent. So desire for safety measures is still moderately higher, I'd say, across the whole population, but it's even higher. It's maybe 10+ percentage points higher for disabled people on various different measures. So this chart here is showing a range of different measures with the responses from disabled people in red, the highlighted in red, and then non-disabled people in grey. And so, for example, the desire for enhanced ventilation, 43% of disabled people are saying it's very important, and a further 50% of people are saying it's quite important. So all in all, we're talking sort of 93% of people saying that is basically an important thing. That's much higher than the sort of 72% overall in the non-disabled population. So it's still high, but it's even higher. And that picture is really quite consistent as we look across a range of other measures, things like crowd management measures, or having staff in place to kind of make sure things run smoothly, and available as your hand sanitizer, information in advance. Across all these things, there's a similar kind of gap. So the proportions thinking it's very important are all a bit higher. The proportions thinking it's quite important are also, bringing it to a much higher total overall. The one thing that maybe sticks out a bit is that the gap is highest for things like information in advance and information on, people wearing masks. So mask wearing is particularly important to consider. Yes, we'll share this in the full data tables later, but that's a bit of an overview. So, broadly speaking, the overall picture is there's been a greater impact in general ways, but particularly in relation to risk and in relation to attendance. There's more desire for safety measures, and therefore organisations need to be looking at ways of ensuring inclusive reopening. I've suggested looking at the "we shall not be removed" 7 principles, but I think from what we've seen, it's also worth bearing in mind that that greater financial impact means that probably people should, organisations may want to be more mindful about financial inclusion as well, as a simultaneous factor. I'll also then look briefly at access measures in general. And really, although there's lots of detail in this, and again, it might be one to look at later or share the data tables later. But essentially, I'm going to look at the same data presented 3 different ways. Which makes it sound like a sort of cooking program, doesn't it? Cooked 3 different ways, but it's the same data. So same ingredients. And this one is showing for a range of different standard accessibility measures that an organization could take, things like accessible information in advance, relaxed performances, detail about seating, quiet and sensory spaces, captions, audio description, hearing loops, wheelchair access, and BSL interpretation. So across the range of these things, we're looking at the whole population and the proportion of people who are saying they're essential, desirable, or neither of those, but split out between the numbers of people who give those answers, who are disabled or not disabled. So dark pink is disabled people who say it's essential, pink is non-disabled people who say it's essential, blue, disabled people who say it's desirable, non-disabled people who say it's desirable. And really this is to emphasize that although for particular measures, there may be relatively small proportions of the whole population who are saying that it's essential, at least disabled people who are saying it's essential. So you might be talking 4% of the population as a whole looking at particular measures. Often the number of people saying it's essential who aren't disabled is boosting it up to 8, 9, 10%. And then there's also very large numbers of both disabled and non-disabled people saying these measures are desirable. So the overall effect is that you can get 40% of the population potentially overall saying actually these measures are useful, this is something we would like to see. So it's, I suppose, emphasizing that accessibility measures are absolutely vital for certain people, and it's important not to exclude people anyway. But in any case, they really have a very wide application, and a lot of the population would benefit from them. And you can see that particularly for some of these measures like accessible information in advance, information about seating, relaxed performances and formats and so forth, that really very, very high proportions of the population need those or want those. And we can see that. I went on too long because I'm aware I'm talking a lot, but if we just look at the figures, so pulling out the dark bars, which is all the different ones which were disabled people, and then looking at the proportion of disabled people overall, we can see that a clear majority of disabled people are asking for accessible information in advance. Over half are saying that relaxed performances would be helpful. A clear majority are looking for specifics about seating and so forth. So really emphasizes how important some of these measures are for particular groups. And worth noting that some things, like SL interpretation, for example, are relatively more likely to be essential. If people want them, they absolutely need them. So there's a much higher proportion of all positive responses are about it being essential. This now, looking at the same picture for non-disabled people, still shows that we're talking about well over a third of people wanting lots of these measures, or around a third in some other cases. So Oliver, again, it's the same kind of thing, the same kind of order.
Oliver, can I just jump in? Someone's asked a really good question in the chat.
Yeah.
Can you just clarify, is this essential for them, or are they being asked, do they think it's essential for an organisation to provide to others? So you just clarify what the wording of the question was around essential and desirable, because I think I know what the answer is, but I just want you to clarify it just for the person who's asked the question.
From memory, it's the phrasing was something like it's for you attending, I think.
Yeah, so it is. Yeah, that's what I thought. So it's very much about whether they find them essential or desirable in relation to their attendance. Yeah, not because they think it's essential for other people. Yeah.
Yes. The one caveat I put on that is that if something is essential for someone you're attending with, then it's essential for you personally because you can't attend without it. It's a bit like that thing about if a restaurant doesn't cater for vegetarians, it not just loses vegetarians, it loses anyone that goes to a restaurant for vegetarian. Yeah. It's a similar kind of equivalent. Yes. So that was probably all I was going to say on that bit, in fact. So just to hand over, I think, to Matthew in one sec, beyond saying, just to re-emphasize really, so access measures are essential for many disabled people, but desirable for many more, but also for many people who aren't disabled. So it's, you know, should also be considered part of general customer service. There will be cases where measures that may be considered to be particularly targeted at disabled people actually benefit a higher sheer number of non-disabled people, just based on the proportions of the population. But generally speaking, similar things are rated as being important overall, with the caveat that obviously for particular people or people with particular types of disability or impairment, obviously those particular measures like audio description, for example, might be particularly important. And seating comes out as being particularly important. Again, that's maybe something that organisations think quite a lot about in terms of information about seating. So yes, so that was it from us. I don't know if Matthew wants to say a few words about your reflections on it.
Thanks, Oliver. So I'm Matthew Cock. I'm Chief Executive of VocalEyes. We're a sector support organisation like the Audience Agency, not quite as big, but we work for and with blind and visually impaired people to increase access, and we often do cross-organisation partnership work to explore, you know, what audiences, you know, kind of pan-disability audiences are kind of their thoughts and concerns about cultural attendance. So it's really great to be working with the Audience Agency on this. I should add, I'm a white man in my mid-50s with short, dark cropped hair and wearing reading glasses. So at the risk of just kind of repeating what Oliver said in a slightly different way, just kind of talk briefly about what the things that I've noticed from the data. And it's really the kind of key message that first slide showing the kind of narrowing of the attendance gap is brilliant, but it really shows that we can't stand still or just return to pre-pandemic even and do what we were doing then with that, because otherwise that gap is going to open up again. And people will be excluding themselves or be excluded from venues. The importance of safety measures, COVID safety measures, accessibility measures, including, you know, affordability, financial accessibility, as Oliver said. And the one thing that there is more data on that we haven't touched on here, but will be in the report that comes out, is there's quite a bit about online as well, and use of online comparing disabled people and non-disabled people. And also the other group that Oliver, there was also a new question in the survey, in the CMP survey, was asking people if they're identified as neurodivergent. And there's some really interesting figures coming from that, showing consistent and significant higher engagement with digital theatre and other online cultural content among people who identify as neurodivergent. And they also said that they would persist with that even after COVID is no longer a key factor. So that's something that's really interesting. And I don't think this has been surveyed before, so or has been published before. So I think it's really interesting. But going back to what we've seen now, I think that the most striking thing for me here was those really high figures, so like 37% and 39% in the case of advanced information and relaxed performances and setting, about the number of proportion of the general population who would find it either essential or useful. And so taking the first of that, advanced information, we've VocalEyes over a number of years done annual campaigns for improving access information on organisations' websites. In 2019, we did one state of theatre access and looked at the websites of about 600 or 700 theatres across the UK. and over a quarter of them failed to have any access information on their website at all. So it's 26%, which just has, that has to change. Otherwise, the 39% of people who find that essential or desirable are going to not go to those venues. The second one was around relaxed performances. So 39% of people in that case said that it was essential or desirable to them. And it just makes me think immediately of Battersea Arts Centre's move in 2020, just before the pandemic, to become a relaxed venue through work with Jess Tom at Tourette's Hero. So it kind of makes me, the figures, that data like that shows how justified that was, and how this should be a movement going across many more arts organisations. And it's also, of course, food for thought about increasing use of captioning, audio description and BSL in a more integrated and inclusive fashion, rather than just on isolated events. So that was some of my thoughts, but I'll end there. I'm really looking forward to hearing other people's thoughts.
Great, thanks, Matthew. So yes, as Matthew says, yeah, we'd really welcome to hear your reflections, comments, questions as well. So if anyone has anything that they would like to share or things that they found out, then please do take this opportunity.